This is LiveWell Talk on a day in the life of emergency room nurse. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's episode is part of a series on the podcast where we sit down with team members and discuss their various roles at UnityPoint Health, Cedar Rapids, get to know what they do on a daily basis and what it takes to do their job. Joining me on this episode is Courtney Spencer, nurse supervisor at St. Luke's Marion ER, and Courtney McGreevy, a float nurse with the St. Luke's ER, to discuss the role of an ER nurse, what they do on a daily basis. Courtney's, welcome.
Thank you.
Thanks. Hello.
Let's you're Courtney 1 and you be Courtney 2.
Okay.
Sure.
So, Courtney 2, how long have you been with the St. Luke's?
With St. Luke's, so I actually came from the Enterprise Travel Pool. So I've been with St. Luke's itself since September. Marion's my first St. Luke's job. But I traveled to St. Luke's main ER a couple different times through the Enterprise. Been with UnityPoint for 7 years.
Let's, I know this get off the subject a little bit, but it'll come back to Courtney number 1, that the Enterprise system float pool.
Yeah.
Talk about that a little bit.
Yeah, so it started to kind of keep the travel inside the system, which I think it's worked fairly well.
Tremendous cost savings.
Yes,
by the way.
yes. So I have worked just about at every larger UnityPoint affiliate. I've been to Sioux City. I've been to Methodist Maine in Des Moines. I've been to Allen. I've been here to St. Luke's. I went to the Quad Cities. So it's just kind of travel amongst, you get that travel of taste, but sense of belonging to one system. So
Okay.
it's been great. Yeah.
Now, Courtney 1, you're in the float pool, so you cover both Marion and St. Luke's, downtown, and Marion, as well as Jones?
Yes.
Okay, so you're kind of like a float pool within our service area, where you were at the enterprise level or system level. Yep. Tell us about, but just take us through what you do on an average day.
I mean, every facility is way different.
Do you know where you're going, like when you get up in the morning?
Yeah.
Okay.
Mm-hmm. Like I have my schedule out 6 weeks like everyone else.
Okay. So
I'm scheduled at each place. I mean, if someone calls in or if they need to move someone around, they try to text you like the day
we
before.
do that all the time.
But yeah, I know where I'm going the day before, so it kind of decides on what time I wake up in the morning. But each facility is very different, as much similar as they can be. They all have their own like vast variety of differences and different patient populations for sure.
Yeah.
Downtown obviously is way busier. I think it's probably the biggest hotspot for all 3 of the ERs, and they see the most patients. Marion, obviously, like Courtney just talked about, we, see a little bit of everything still, but it's not as busy. And you still see like kids and older population. And then out at Anamosa, it's more of like your elderly population. A lot of sick people, but still a smaller, like not as busy facility like Marion. So they're all very different, but they try to run as similar as possible.
Yeah. And all of them staff with Eastern Iowa Acute Care or Emergency Medicine Group.
Yeah. So we use the same providers.
Like Dr. Sunderman and his team.
Yeah.
You became a nurse. Let's go back to Courtney number 1. So you became a nurse.
I did.
How? Where'd you go?
So I started off, I got my CNA in high school. As a senior, I decided that healthcare was the route I wanted to go. I enjoyed taking care of people. I have a passion for just, being by someone's side when they're going through something rough. So I got my CNA. I worked in a couple nursing homes here in town, and then I actually started at St. Luke's as a patient care tech. That kind of in tune started my journey at UnityPoint. I went to nursing school at Kirkwood. I did their 2-year ADN program. I graduated in the summer of 2019. At that time, I did an internship in the ER and fell in love with emergency medicine, the fast pace, the chaos, everything, and kind of went from there.
Courtney, too, what's your nursing journey?
Yeah, so like Courtney number 1, I got my CNA in high school. At that time, I really wasn't quite sure what I wanted to do. So I took a couple years off and just did some gen eds at NIAC. And then I came home, worked as a CNA in a nursing home, and I realized I want to work in the healthcare field, but I don't want to be a CNA forever. Bless those that can, but that just wasn't for me. So I went back to school at Marshalltown Community College, got my LPN, then I got my RN, got a job at the UnityPoint Marshalltown Hospital on the med-surg floor. It's like, yep, let's go back and get my bachelor's. So I actually went back and got my bachelor's through Upper Iowa, and then transferred to the UnityPoint ER at Marshalltown, and then to the internal float pool, and now at Marion. So
I'm going to put you on the spot
Yeah.
since you've been all the affiliates.
Yeah.
What do you think about the culture?
I like it. I think it's very inviting. I think St. Luke's wants to keep their staff. They want their staff to succeed, whether if that's in the department they're in right now or somewhere else. Like, hey, this might not be the great fit for you, but where can we keep you? Where can we find you a home? You don't get that everywhere.
Yeah. Well, our philosophy has always been if people move on to better things, that means they were good. And so,
Right.
that shows good leadership,
Yeah.
and you can train people to manage up or move
Right.
up, et cetera, relatively speaking.
When I was leaving the float pool, I left the float pool because I had a baby, so I knew I wasn't going to be able to travel, but I knew I wanted to stay within UnityPoint within St. Luke's. So just trying to find that avenue, and that's kind of where the Marion opportunity came up, and I'm very thankful for it.
Yeah. No, Jillian's doing a nice job
Yeah,
out there.
she is. She's
I'm really
fantastic.
happy with what she's doing. So just walk me through your typical day as
Yeah.
a supervisor.
So when I come to work, I try to get to work about 7:30. I try to check in with my staff, make sure, nothing crazy has happened overnight. I try to get word of mouth first. Of course, there's always emails, RLs, that kind of stuff. But if I can connect with my staff, see the whites of their eyes before I even turn my computer on, then I know I'm doing something right. And I feel like if I can just have that honest conversation with somebody, word of mouth, it's going to be portrayed better in my mind. Once I do that, I check emails, make sure we're staffed appropriately for the next couple days, and address anything that needs to be addressed at that time. Otherwise, I typically am starting to work on education for my staff, whether that's triage education, upcoming meetings, trying to figure out how to support these guys. That's my job. I also am a dual role as the clinical nurse lead for the Marion Emergency Department, so they really encourage us to coach at that elbow. So I'm trying to navigate that and how I can incorporate that with my staff.
Yeah, that's important.
Yeah.
Do you, like our nurses down here are people just constantly screaming your name? Courtney.
It's not constant,
Okay.
but I do know I'm a little uneasy. I will say I'm a little uneasy if I leave work for the day and I haven't had a question asked. And that's not because I just want to make sure that I'm present and my door's open and that they know they can approach me. So if I haven't addressed somebody or addressed an issue, then I know I'm not doing my job
Right.
to the full ability.
Right. Here's what I say. I say to myself, if my day isn't disrupted and problems arise that I fix, then they didn't need me.
Right.
I mean, if I just go to work and
It's nice to be needed.
yeah, it is. I mean, well, you feel like you made a difference. You
Yes.
go home, you leave, and you're like, well, that day sucked,
Yes.
but at least I made a difference.
Yeah.
Leaving bedside was very difficult for me, and I envision someday I'll probably go back. But I still need to be needed, just differently this time.
Yeah.
My patients might not need me directly, but my staff does. So how can I fill that role?
Well, Courtney, so you know where you're going to go spaced out, unless Courtney 2 looks at her staffing and says, get Courtney 1 in here.
Yes.
Yeah. Maybe we should get you guys shirts like thing number 1, thing number 2
Honestly.
from like Dr. Seuss.
It was, so before I went into the float pool, I actually was staff at just Marion. I did a travel assignment there as a travel nurse for 3 years before I came back to St. Luke's.
Okay.
Did a travel assignment at Marion, fell in love with just the way that it felt when you walked in the door and everyone working together. And Courtney was on maternity leave at the time, and everyone thought I was the manager. And I was like, it is not me. I'm not playing that role yet. But so when I worked there as staff, everyone would be like, Courtney, and we'd both be like, yeah. I'm like, I could probably answer the question, but
Are you from Iowa also?
I am, yeah.
Where at?
So I'm from here in Marion.
Okay.
That's kind of how I was actually born and raised at St.
you go to
Luke's.
Linn-Mar?
I did.
Okay.
You're like, okay, no more questions.
All further questions will be directed to Courtney number 2 at this point forward. I went to Kennedy, so they were always kind of our rival.
But
Now, you talked about the care and the chaos of the emergency room. Is that what attracted you to it
Yeah.
too?
Yeah.
Yeah.
I think,
special breed.
yes. I live a very organized, chaotic life.
Yeah.
Personally and professionally, and that's the way I like it.
Yeah.
So,
Each floor has their own personality.
yes.
Like, the rehab, they have patients, and their patients get better over time, and they get to see their patients get better and leave, and that's really important to them. Like cardiac nurses need, what's the heart rate? Okay, let's slow down. Let's speed it up. They need to fix the problem right away. Then it can't have lingering problems. And I do think the emergency room is the variety and the chaos. attracts people that, even physicians, you know. I think it's keeps you on your toes and people get better, you know, so most of the time when you see them. So that's always rewarding. What sort of, you have the same requirements for ongoing professional education as registered nurses, of course, just like physicians have their ongoing CME, et cetera.
Yep.
But is there anything specific for emergency room nurses?
Yeah.
Yeah, there's a few things that we can do above and beyond. I mean, obviously, beyond like the national certifications, like a certified emergency nurse, you know, you have those in all your departments. But emergency specific, we do like extra education on trauma nursing core competency and care. More with like peds, emergency pediatric nursing care, NRP, neonatal resuscitation. It's just some extras to kind of put in those things that we don't necessarily see every day, but we need to be ready and prepared.
Yeah.
So those are just extra certifications that you take every 2 to 4 years, depending on the course.
Yeah, my philosophy's always been like ACLS, et cetera, ATLS, that you need to take those because you can get in a silo and just keep doing it the way you're trained, and 15 years can go by and you've missed like 3 updates on ACLS. Yeah. So I think that certification is important.
Yeah.
Well, and the nursing field is forever changing. I mean, one thing that worked today could not work tomorrow, and they might, you know, make a different algorithm or a different protocol. And
right. Absolutely.
Always having to be on top of that too.
I had a meeting earlier today and it came up about AI, and I'm like, kind of, you know, I'm in my career that I'm closer to the end than the beginning. And I'm like, okay, how much do I have to know AI? And the quote that Dr. Kuehl gave me was that AI won't replace physicians, but physicians that aren't using AI will be replaced by physicians that do. So, I mean, I think that's a growth potential that we're going to see in the field. Yeah, it's everywhere.
Absolutely.
It really is. So that's very interesting. So, do I have to have an RN to work in the emergency room?
You do.
As a nurse.
As a nurse. So
there's other roles.
So LPNs.
Right now, we're not utilizing LPNs.
Okay, so we have RNs and then...
We have paramedics.
Okay.
So I know we use some at Maine. There's the potential. But at Marion, we staff with at least one RN, and then it can be an RN or a paramedic. They're critical care paramedics, so they've had extra training. It's a nice mix. They bring a different skill set and a different knowledge base than what the nurses are. If I have a question about a vent, I'm turning to my medic because they have way more experience with that and training than I received in school.
Are there any other certifications that nurses can have?
Yeah. I mean, so you talked about like the CEN. Yeah. So like every nurse, if you are a nurse in the ER, you all have your RN. Anyone else can have their BSN. They can go above and beyond like you did. But then we also carry like our TNCC, our ENPC. We do all have ACLS, PALS, BLS. But then you can get your certified emergency nurse. You can get your SANE nursing. You can get your TCRN, so your trauma certified nursing.
Pediatric side.
Yeah.
SANE nursing, sexual assault nursing examiner.
Yes.
Yeah.
Yes.
Very, unfortunately, a very high demand for their service. That's a whole nother podcast.
Yeah. There's changes coming with that.
It's a tough one.
Yes.
What advice would you give someone, you know, in your position, or what advice would you give yourself 10 years ago?
Do the work. It's worth it.
Stay the course. Trust the plan.
Course, yeah. Yeah. I took, like I said, I took a break. I didn't take a traditional course. I went back to nursing school when I was 22 years old. And I woke up one day and I decided if I don't go back this year, I'm never going back. And what does your life look like? Yeah. And it does make me a little bit emotional because it was at a very different time 10 years ago. Oh, that was 10 years ago.
Not to disclose your age.
Yeah. But just to do the work.
She's 32, everyone.
I am, and it's okay. But it's worth it. It's worth it. It's worth it to see, you know, that mom that you just helped their child. It's worth it to see the 80-year-old lady that needed help putting her shirt on. It's worth it. Just stay the course. Like, you're meant to do something, and just trust your gut and do it. Do the hard work. Do the hard things. Look, I have looked myself in the mirror every day and say, you can do hard things.
You can.
And I
And
would
you
do
do.
that. Yeah, and we do.
I
We
like
do
to.
it every
I
day.
like to say you need to know your why,
Yeah.
and people that know their why have they're really, their life is blessed
Yeah.
because they know their why. They know what makes them and why they do what they
Yeah.
do, and embrace it. So, Courtney, how about you? What would you tell a 10-year-old? So that'd be 10-year-old Courtney, right?
Oh. Not that much younger than
okay.
Courtney. But no, not quite. Gosh, I've been
Yeah.
an ER nurse for 6 years. 10 years ago, I mean, I would just say keep putting that 1 foot forward. I mean, it's challenging and it's meant to be challenging. Nothing good comes easy. And at the end of the day, most days are rewarding. So honestly, just go into it headstrong with an open mindset and just take the education and learn from it, you know?
Yeah. And like I said, if you have a bad day,
Yeah.
it's disrupted and patients and, they needed you.
Mhm.
It was, otherwise you could have just phoned in your day if they didn't need you, right? You know,
Yeah.
I mean, so that is a lot of fun.
I was always told as an ER nurse specifically, like, if you ever get comfortable, you need to leave. Like, you should never be comfortable in your work. You should always be learning, and there should always be a new challenge or a new piece of education that you're willing to accept. So take that with a grain of salt and
All
just
right.
go for it.
One last question before we wrap up.
Yeah.
We'll start with Courtney 1.
Oh, gosh.
What's your favorite medical TV show?
Well, I am not going to say the traditional probably answer of Grey's Anatomy. I actually have recently gotten onto the new medical show of Pitt.
So I watched that too, yeah.
I do like Pitt a lot. I feel like it's a lot more realistic. It's very comparable to like what we see on a day-to-day basis. Not everything. I mean, we live in Iowa, but very similar to like the fast-paced chaos and everyone working together.
The only thing that kind of annoyed me as being in a leadership position is that, their CMO didn't really seem to care about them. And that's not true,
Yeah.
and we have other pressures and multiple constituents that we have to serve, but we care about our docs and our nurses.
For sure.
Yeah. Yeah, that was a good show.
It is a good show.
Yeah. Courtney,
yeah.
too.
I have not watched a lot of medical shows. I watched Grey's Anatomy in my younger years, and I stopped watching it. Kind of put a bad taste in my mouth. So that's fair.
Yeah.
I guess.
Because, for Pitt is kind of like work.
Mm-hmm.
Yeah.
Grey's Anatomy is not like what we do.
No, it's not.
It is more so
Medical.
like, wow, people actually do this. Like, they actually understand that this is
Might
what
have
we
to
go to
watch
work and
that.
do. Yeah.
Or, I won't go into the detail. There was one of the episodes, the hours, because it follows a shift
Yes.
of like 15 hours. There's one thing on there that I always complain about, and it's so funny that they did it on the show, and I was like, oh my gosh, see, we're not the only ones that complain about
Yeah.
that.
Yeah.
Anyway.
It just makes you feel heard almost.
Yeah, it does. It validates
Yes.
what you believe. Mine's House. I like House. That's
Oh, that
my
is
favorite
good.
one.
I've seen that a few times.
Yeah, that's my favorite one. Well, Courtney 1, Courtney 2, thank you again for joining me and sharing a day in the life of a emergency room nurse. Once again, this was Courtney Spencer, nurse supervisor for the St. Luke's Marion ER, also known as Courtney number 2, and Courtney McGreevy, known as Courtney number 1, a float nurse with the St. Luke's Emergency Room Service. If you're interested in a career in nursing or any other role at St. Luke's, visit joinuph.com, joinuph.com. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.